Okay, again, hello everyone. This is Dr. David and welcome to this presentation. We'll be talking about your brain on fire, or the brain on fire. And of course, it's explaining the fundamentals and what happens, why things happen to us as we age. Okay, this is not meant to be a substitute for your healthcare provider, your doctors, professional help and expertise. This is to help you understand how things work and what to do to keep yourself healthy. If you are on any long-term medication or any treatment, please check with your doctor before making any drastic changes. That is very, very, very important. Please remember that. Before I introduce Dr. Sears, I just want to read out this quote because I think what Dr. Sears is doing with his work with the omegas and the other things that the Zone Labs are creating, I think this aptly describes their work. And here goes. As knowledge with regard to the effects of food upon man increases, it is more than conceivable that the races that first avail themselves of the new values of nutrition may decrease the handicaps of disease, lengthen their lives, and so become leaders of the future. Okay, I'm going to hand this over to Dr. Sears, and I'm going to read his bio. Again, Dr. Sears, thank you so much. Let me hand this over to him. Okay, Dr. Barry Sears is a leading authority in the dietary control of hormonal response. He is a former research scientist at the Boston University School of Medicine and at the Massachusetts Institute of Technology, MIT. He has dedicated his research efforts over the last 30 years to the study of lipids, which are fats. He holds 13 U.S. patents in the area of intravenous drug delivery systems and hormonal regulation for the treatment of cardiovascular disease. There's a lot to be said about him from his bio, so I'm just going to skip a few things. Most of you probably know him from his books, the Zone series. Of course, his landmark book was the Zone. And the Zone has sold over 2 million hardcover copies, and it became a #1 bestseller on the New York Times book lists. That has been followed by several other books, all best sellers, and including the Omega RX Zone, the Anti-Inflammation Zone, which I've read with great satisfaction, and his newest book, Toxic Fat. He's actually done a presentation for us on toxic fat, and that's part of his series. Dr. Sears is on TV a lot. And everything from 2020 to today to Good Morning America, CBS, CNN, and MSNBC. His website is drsears.com, and you can also go to zoneliving.com, which showcases his research and his work. So without much further ado, I'm just going to hand this over to Dr. Sears. And Dr. Sears, again, thank you so much for all you do to educate people around the world and for working with us. Over to you.
Well, David, thank you very much for that very kind introduction. And geez, I hope I can live up to the introduction. But tonight, what I'll try to do is to really focus on inflammation in one particular organ in the body, the brain, and really talking about what happens when the brain becomes inflamed. And that's why we call this seminar "The Brain on Fire," and looking at the role of inflammation in various neurological diseases. And once you understand that role, then begin to fortify or put together a dietary strategy to put out the fire in the brain. Oops, and we have our little problem here, so let's try this. Let's see if this works. We'll begin with, as we've talked in the past, that the recognition of the importance of inflammation is growing throughout our society, both in terms of the medical profession and the general public. This was a Time magazine article several years ago that the cover story was entitled "The Secret Killer: The Surprising Link Between Inflammation, Heart Attacks, Cancer, Alzheimer's, and Other Diseases." And that's as we understand more and more about this inflammation It's almost like as if all roads in medicine lead back to this as really the source, the cause of why we don't live as well or as long as we possibly should. In many ways, I think we make medicine a lot more complex than it really is. Because if you step back from virtually every chronic disease state, what do you find? You find evidence of increased inflammation. So what exactly is this inflammation? The ancient Greeks, they try to describe it as the internal fire. The ancient Romans try to describe it as heat, pain, swelling, redness. And in fact, that's how most physicians describe inflammation today, which says our understanding of inflammation really hasn't progressed a lot over the last 2,000 years. On the other hand, what we do know about inflammation, it's a very, very complex orchestration of both pro-inflammatory and anti-inflammatory events, as if you're turning on the inflammatory response and then turning it off. And if these are balanced, then we call that wellness. On the other hand, if we turn on inflammation and we can't turn it off, basically that starts the pathway of basically acceleration of chronic disease. We also know that inflammation is usually associated with pain. Something hurts. That's why you go see a physician. But we know that pain is mediated by a unique group of hormones called eicosanoids. Now, how do we know that? Because virtually every anti-inflammatory drug known in the medical science, ranging from aspirin to non-steroidal anti-inflammatories to COX-2 inhibitors or corticosteroids, they have only one mode of action: to reduce the level of inflammatory eicosanoids, the eicosanoids that cause pain. Now, if we didn't have an inflammatory response, we'd be sitting ducks in a very hostile world. We're in constant competition, really a battle for survival against microbes. And if we didn't have a strong immune response, those microbes, if they invade the body and get a foothold, would overwhelm us and kill us very quickly. But it's our strong inflammatory response that is able to hold these microbes at bay. We also know that injuries also elicit a powerful inflammatory response in the body. So if we had no inflammatory response, we'd be a sitting duck for microbes, and our injuries would never heal. But now we know there's a third component in our life that can turn on these same powerful inflammatory responses, and this is called the diet. Because there are really two types of inflammation. There's a type most people are accustomed to. I call this screaming pain. Something really hurts. The organ hurts. The joints hurt. And basically you know you're inflamed. But a much more subtle, a far more insidious type of inflammation might be described as silent pain. This is inflammation at the cellular level. It's this type of inflammation that the Time magazine article I discussed earlier was really describing. This silent inflammation, the cellular inflammation that has no pain, basically now begins to destroy organs slowly until there's enough in-organ damage after years, if not decades, of constant inflammatory attack that we call it chronic disease. Now, we couldn't talk about this concept of cellular inflammation unless you could measure it. And only recently have we had any type of blood markers that could measure this. The first blood marker introduced about 8 years ago was called high sensitivity C-reactive protein. Frankly, it's not a very good marker, it's non-specific, and it's very highly variable due to infection. The marker that we've been promoting over the last decade is the ratio of two fatty acids in the blood. One is called arachidonic acid, or AA. This is the building block of all the pro-inflammatory eicosanoids. The other fatty acid is called eicosapentaenoic acid, or EPA. This is the building block of many of your anti-inflammatory eicosanoids. It's the balance of these two fatty acids in the blood that will tell you with frightening precision what the balance of these two fatty acids are in your 100 trillion cells in the body. The better the ratio, that is the lower the ratio, the less cellular inflammation you have. The higher the ratio, the more inflammation you have at the cellular level, and this will be now accelerating chronic disease. Unlike C-reactive protein, this is a very precise marker, and it's more importantly, it's highly reliable. In many ways, consider C-reactive protein as a downstream marker of inflammation. That means you've been inflamed for a long time before C-reactive protein actually increases. Think of the ratio of arachidonic acid to EPA as an upstream marker, the first sign you are no longer well. You may not be sick yet, but you can definitely guarantee you are no longer well, and now you're on a slippery slope toward developing some type of chronic disease. Well, now that we can measure cellular inflammation, we might ask what disease states are associated with it. Well, the two disease states which stand out as being epidemic in America, obesity and type 2 diabetes, are both driven by cellular inflammation. I've talked about these in a previous lecture, how cellular inflammation causes insulin resistance, and that basically makes us fat and causes the acceleration of the development of diabetes. I've talked earlier about heart disease, cancer, but tonight I really want to focus on neurological diseases such as Alzheimer's, ADHD, brain trauma, multiple sclerosis, and Parkinson's. So let's look at some typical arachidonic acid EPA ratios in Americans. Well, or actually, we'll start with the Japanese. Why do I start with them? This is the population who have the highest degree of longevity in the world today. But more importantly, they have the longest health span. This is longevity minus years of disability. And they also have the lowest rates of depression in the world and the lowest rates of heart disease, even though their cholesterol levels are almost identical to Americans. But if we look at their ratio of arachidonic acid to EPA, it's about 1.5. So whatever the Japanese are doing to get there seems to be working pretty well for them. Let's go for typical Americans who are, quote, healthy. You can see their ratio is 10 times greater, which says one thing: we're far more inflamed. And that's why our healthcare is careening out of control. It's the cellular inflammation that's become epidemic in America that's driving the development of chronic disease at earlier and earlier ages. Now, these are so-called healthy Americans. What about Americans who have depression? The ratio goes up. Or Americans who have attention deficit hyperactivity disorder, still higher. And what about those who have brain trauma? Still higher. In our laboratory, we do this testing on a routine basis. We've seen levels as high as 300 in otherwise seemingly normal individuals, but if you probe a little deeper, you find out they're not quite as well as they think they are. That's why this marker of cellular inflammation is such a powerful predictive factor of what your medical future will be. So the question is, if this is such a powerful clinical marker, what really causes it? We've already alluded to it. It's the diet. But what in particular in the diet? Well, as usual with nutrition, there's no simple solution. And when we deal with cellular inflammation, it's really a confluence of three unique factors. They have to come together at the same time. And that's why I call this the perfect nutritional storm. The first factor is increased consumption of omega-6 fatty acids. Why is that important? These are the building blocks to make arachidonic acid, and the more arachidonic acid you make, the more inflammatory eicosanoids get produced by the body. Where do you find omega-6 fatty acids? In common vegetable oils, things like corn oil, soybean oil, safflower oil, sunflower oil. These are the primary components in the American diet. Why? Because they are now the cheapest form of calories known to mankind. But by themselves, they're bad, but they can be made even worse in the dietary consequence of increased consumption of refined carbohydrates. This occurred because refined carbohydrates enter the bloodstream quickly. They have a very high glycemic load, and by doing so, they increase the production of the hormone insulin. When high levels of insulin mixed with high levels of omega-6 fatty acids. This is like adding a match to a vat of kerosene. Basically, they now work with each other to basically give an explosive increase in the levels of arachidonic acid in our body. But we've always had one trump card as a species to keep excess arachidonic acid under control, and this is adequate intake of omega-3 fatty acids, especially those rich in EPA. But over the last century, the amount of EPA in our diet has probably decreased by nearly 95%. And today, the average American consumes only about 125 milligrams a day of long-chain omega-3 fatty acids, meaning both EPA and the other long-chain fatty acid, DHA. These are incredibly deficient levels. And as a consequence, without adequate levels of omega-3 fatty acids in our diet, it's as if we're running a nuclear power reactor and we're taking out the control rods. What happens when that occurs? You get a nuclear meltdown. And that's exactly what's happened in America in the last 40 years. We've been seeing essentially a meltdown, a China syndrome of inflammation, because we've increased our consumption of omega-6 fatty acids, we've increased our consumption of refined carbohydrates, and we have radically decreased our consumption of omega-3 fatty acids. And when all three trends come together, then you have a surefire prescription for increased cellular inflammation. And this all started in America 40 years ago and now is spreading worldwide. Now let's go in a little more detail to look at the actual molecular pathway for this increasing of cellular inflammation. Well, it begins with omega-6 fatty acids, and the primary one that we consume on a dietary basis is called linoleic acid. It seems so benign, and it really is, but it's acted upon by certain enzymes that speed up its process toward making arachidonic acid. The first enzyme is called delta-6 desaturase. This particular enzyme is activated by insulin and inhibited by the long-chain omega-3 fatty acid called DHA. So you can see as you increase the levels of linoleic acid by eating more vegetable oils and eating more refined carbohydrates to increase insulin, you're going to be, and taking out DHA, you're going to start now transforming linoleic acid into its more powerful precursors toward arachidonic acid. Its first transformation is into gamma-linolenic acid, which is then transformed into dihomo-gamma-linolenic acid, which is then acted upon by another enzyme under hormonal control. This is the enzyme known as delta-5 desaturase. It too, like the delta-6 desaturase, is activated by insulin. But unlike the delta-6, this particular enzyme is inhibited by EPA. So you begin to see the importance of EPA not only as a building block of anti-inflammatory eicosanoids, but as an inhibitor of the conversion of dihomo-gamma-linolenic acid into arachidonic acid. Because once that happens, this arachidonic acid, which you might term as toxic fat, is your worst hormonal nightmare, because now you start building up cellular inflammation in every cell in the body. So our goal is really putting out the fire in the organ that's under the most attack. Tonight we'll talk about the brain. So what happens if you had a house and the house is on fire? What's your first response you want to do? You want to put out the fire. That's why I call the fire department. They bring the fire engines, they bring out the hoses, they put the water on the fire, and they put the fire out. That's what high-dose fish oil does. It's your first response. You can cause the rapid reduction of existing inflammation. But when the fire department leaves your house, the fire's out, but your house is in ruins. That's why you have to now look to rebuild the damaged tissue, in this case the brain, but rebuild it in such a way to prevent the inflammation from returning. This is why you need an anti-inflammatory diet, and in particular, the zone diet, to cause that rebuilding. So we can use fish oil, high-dose fish oil, which can be directly targeted to the brain to put out the fire, but we've got to now basically rebuild the damaged tissue. in such a way that we keep inflammation under control by controlling both the intake of omega-6 fatty acids and controlling the levels of insulin. Now, when we look at the two fatty acids that we're looking at, arachidonic acid and EPA, you can see from this figure they look virtually identical. You have to look very, very closely to find the differences. And the particular difference is really one additional cis double bond in the fatty acids. But because they look so identical and basically are very similar to each one structurally, that's why they can interfere with the enzymes downstream that make pro-inflammatory eicosanoids. This is how anti-inflammatory drugs work. They cannot reduce arachidonic acid, but what they can do, they can interfere with the enzymes that will convert arachidonic acid into very, very powerful pro-inflammatory eicosanoids. But they have some collateral damage. And some of the collateral damage of anti-inflammatory drugs, especially if you're taking them on a chronic long-term basis, are things like heart disease, osteoporosis, but their biggest problem is called death. In fact, more people die each year in America from taking the correct dosage of anti-inflammatory drugs than die from AIDS. On the other hand, the long-chain fatty acid EPA basically is a competitive inhibitor. If it's present at the same time, it can inhibit the binding of the arachidonic acid to the same enzymes and therefore prevent the formation of a pro-inflammatory eicosanoids. Now, nature worked out a very elegant way of controlling inflammation hundreds of millions of years ago, but we've forgotten how to basically use those pathways, and that's why we're caught in a grip of a massive epidemic today of cellular inflammation. But this also explains why the ratio of these two fatty acids can predict with great certainty what your future will be. Because if you make arachidonic acid, where it goes, nobody knows, because it can be operated on by two enzymes. One's called the COX enzyme. This is the enzyme that makes prostaglandins. This is the enzyme that's inhibited by aspirin or non-steroidal anti-inflammatories or COX-2 inhibitors. But this arachidonic acid can also be acted upon by another group of enzymes called the lipoxygenase enzymes, and this makes leukotrienes. And the only drug that can inhibit the formation of the formation of leukotrienes are called corticosteroids. This is basically your last armament you have drug-wise to control inflammation. It's the most powerful drugs we have, but there's tremendous collateral damage by using corticosteroids for any more than a short period of time. But that's how we operate from the world of pharmacology. We'll find drugs that can inhibit either LOX or COX enzymes. I started out some 30 years ago saying it makes a lot more sense, rather than trying to find new drugs that have collateral side effects to basically inhibit the formation of leukotrienes or prostaglandins, why not simply go upstream and reduce the levels of arachidonic acid? It makes more sense. You squeeze off arachidonic acid, and de facto, you squeeze off the production of both inflammatory leukotrienes and prostaglandins. But there's no drug that can do that, because arachidonic acid is 100% controlled by the diet. And though it was quite clear to me some 30 years ago, that's the way we have to practice medicine in the 21st century, it's obviously taken me 30 years to try to get the points across to people saying, we have the answer. The answer lies in our kitchen, and how to basically reduce that levels of arachidonic acid in our body. Now, if you have excess levels of arachidonic acid, here are the usual suspects that are going to cause cellular inflammation. PGE2, thromboxane A2. Both these are prostaglandins, again, derived from arachidonic acid. And finally, we have the third suspect, leukotriene B4. This is a leukotriene also derived from arachidonic acid. Once these eicosanoids are made, these very powerful pro-inflammatory eicosanoids, your life is going to be a mess. Now, you can take anti-inflammatory drugs, and they have some side effects, like I said earlier, like death, or wouldn't it just be simpler just to basically decrease the levels of arachidonic acid in your body? Call me crazy, but I go for the latter approach. Now, how does high-dose fish oil really work? Well, as we pointed out, it inhibits the formation of arachidonic acid, but it also dilutes out arachidonic acid in the cell membrane. The fatty acids by themselves are usually tied up in the formation of phospholipids, and in this form, basically tied up as phospholipids, they can't be made into eicosanoids, but they can be released by certain enzymes called phospholipases. And when the phospholipase reaches into the membrane and starts to cleave off the phospholipids to release these fatty acids, it's not very smart. It's like reaching into a pot with a blindfolded person reaching into a pot trying to find out the prize. So the more EPA you have in the membrane and the less arachidonic acid you have in the membrane, the more likely when the cell activates this phospholipase to bring out a fatty acid, you're more likely to bring out a winner, that is EPA, and less likely to bring out a loser, arachidonic acid. We also know these fatty acids can change the expression of our genes. This is what we've learned from molecular biology in the last decade, that these fatty acids are very powerful activators of what are called gene transcription factors. We also know they can change membrane fluidity, very important in terms of neurological tissues, and they can change the levels of ion channels. These fatty acids are incredibly powerful. They do many, many things, but it's all based upon the balance. The balance of these fatty acids will begin to affect all these different aspects of how high-dose fish oil can work to improve your health and, more importantly, your brain health. So, but why do we talk about high-dose fish oil? Well, first of all, especially in the brain, first of all, the brain cannot make arachidonic acid, it cannot make DHA, and it can't make EPA. It can only basically take it up from the blood. But these fatty acids have to pass through the blood-brain barrier, and that's a slow passage. And therefore, the levels of these fatty acids in the brain are controlled by the levels in the blood. If you have high levels of arachidonic acid in the blood, you'll have high levels of arachidonic acid in the brain. If you have high levels of EPA in the blood, you'll have high levels of EPA in the brain. Now, why don't we talk about DHA? Well, DHA is an omega-3 fatty acid. It has a lot of structural benefits in the brain. It also has effect on membrane fluidity, but it's very weak in terms of ability to reduce inflammation. And here's the problem with the brain, that the arachidonic acid and the DHA, once they get in the brain, they have a very long half-life. Now it's estimated to be about 2.5 years. So once these fatty acids get in the brain, they stay there for a long time. On the other hand, the half-life of EP in the brain is about 2 weeks. It's very rapidly oxidized in the brain. So when you look at brain biopsies, or basically in terms of brain levels, you don't find very much EP in the brain, leading people to the mistaken feeling that EPA isn't in the brain. It is, it's just being oxidized very rapidly. And that's why to maintain an appropriate level of arachidonic acid EPA in the brain, you have to maintain high levels of EPA in the blood, and more importantly, a low ratio of arachidonic acid EPA in the blood to maintain inflammatory control within the brain itself. So let's talk about rebuilding the brain. Well, first of all, we could look at diet. Remember we said about anti-inflammatory diets? You might say, show me the data. Well, here's some data from Harvard Medical School. This is what they published, now about 7 years ago. They took overweight individuals who were inflamed, besides being overweight, and that's why the two work are always fine, usually coincident, and they put them on 2 different diets. One is a diet recommended by the USDA, and the other diet was a zone diet. And they both lost exactly the same amount of weight. So leading people to think all diets are the same. But when you look at their reduction of one of the downstream markers of inflammation, the zone diet was 9 times more effective in reducing downstream inflammation than the USDA diet. And isn't that what you want to do? You want to reduce excess inflammation in the body. We've also published studies. This is one of our studies we published back in 2006, comparing very carefully ketogenic diets like the Atkins diet to the zone diet. And what you find that if you look at the ratio of arachidonic acid to EPA on a Atkins-like diet, it doubles in nearly 6 weeks. Whereas in the zone diet, it actually decreases. That's why you have to look at the diet as a way of basically really controlling on a long-term basis the ratio of these two fatty acids if you want to be successful in rebuilding damaged tissue. So the question is, how difficult is it to follow the zone diet? Well, it's not too hard as long as you have one hand and one eye. And all you have to do is the following. At each meal, simply divide your plate into 3 equal sections. On 1/3 of the plate, you put some low-fat protein. How much? The amount you can put on the palm of your hand. Before you get too excited, that's also the thickness of the palm of your hand. That's about 3 ounces of low-fat protein at a meal for a woman, and about 4 ounces of low-fat protein at a meal for a male. So what about the other 2/3 of the plate? Now you fill it until it's overflowing with colorful carbohydrates. What are those? They're called fruits and vegetables. They not only have a low glycemic load, it means they enter the bloodstream slowly, therefore not eliciting a great response of insulin, but the color comes from chemicals known as polyphenols. And in high enough concentrations, these polyphenols also have anti-inflammatory effects. And the last thing you do, you always add some fat to each meal. How much? A dash. What's a dash? A pretty small amount. But you just make sure that you're adding good fats. What are good fats? They're low in omega-6 fatty acids and they're low in saturated fats. Not because they're evil demons, because both of those have inflammatory reactions. At the same time, you want to basically restrict the consumption of fats which are high in omega-6 fats. Again, you're looking to choke off the substrates to make arachidonic acid. So let me give some clinical examples of how diet, both the zone diet and also high-dose fish oil, can affect neurological problems. This is one study. This is what's called a SPECT scan, and you've probably seen a previous seminar here by Dr. Dan Amon, who was a close friend of mine. We've worked together for many, many years. And what Dan does in his SPECT scans is to look at blood flow. That if you have normal blood flow, it's not impeded or doesn't have high hot spots, the brain is pretty much overall uniformly blue. But what you can see here in children with levels of ADHD, that before they're given both a combination of the zone diet and high-dose fish oil, you see a lot of abnormalities. These are hot spots where the blood is really basically coagulating, and there's other spots which are basically almost voids. So we have abnormal blood flow in the brain. But after the combination of omega-6, of omega-3 fats, very high dose, and the zone diet, you see a normalization of blood flow in the brain. Now, this is a study we published several years ago, taking children who were basically had attention deficit hyperactivity disorder, who were already on their optimal dose of drugs to treat their ADHD. And what we did, we put them on high-dose fish oil and told them to try to follow the zone diet the best they could, and looked at the ratio of arachidonic acid to EPA in their blood as a function of time, time being about this is a 2-month study. You can see in the first slide that at the beginning, before we started to do any dietary intervention, their levels of the arachidonic acid EPA was quite high. And with those who were compliant with the program, that the levels dropped dramatically within the first month. And they stayed low for the next month. But you can see there are 2 outliers. The one here in the gray, who really wasn't taking the fish oil, and the levels never went down very much. And this one here in the orange that was compliant the first month I said, I give up. I don't want to do it anymore. And within a month, the levels were back up to baseline. And we could also at the same time have an independent psychiatrist, give a global assessment. He was blinded to who was not taking the fatty acids. And you can see that those who basically had seen their levels of arachidonic acid EPA drop, that there was an improvement in their overall global impression by the psychiatrist, an improvement over and above that induced by the drugs. We could also look at this in terms of the severity of the illness as measured by this global improvement, looking at the ratio, the reduction in the ratio of arachidonic acid EPA. And what you find is a straight line relationship. These are the various points. These are the 95% confidence curves that says that as you reduce the ratio of arachidonic acid EPA in the blood, you see a striking improvement that was highly statistically significant in just a matter of 2 months. Let's go to another area, traumatic brain injury. Now, this, we don't talk much about this, but this is the leading cause of death and lifelong disability, both among children and young adults in the United States. We hear a lot about now from our young soldiers coming back from Iran and Afghanistan that basically with this traumatic brain injury, they have a lifelong problem. Their brain is basically damaged and basically is not being rebuilt. About 1.5 million Americans basically get brain injury every year. It could be falling off a bicycle, it could be playing in the NFL, it could be having hit by a baseball, it could be basically being an explosion in warfare. But of that 1.5 million, about 250,000 are severely damaged enough they have to be hospitalized, and 50,000 Americans die every year from traumatic brain injury. A major cause of death that we try to kind of sweep under the rug. This is one of our cases about 5 years ago. There was a major mine disaster called the Sago mine disaster. This is a mining disaster where 13 miners went into a mine on, I believe it was New Year's Day, and there was an explosion that trapped them in that mine for 41 hours in a carbon monoxide atmosphere. When they finally broke through and tried to rescue the miners, 12 of the 13 were dead on arrival. The one they brought out was alive. This is the one person, Randy McCoy. And when they brought out Randy from the mine, he had not only heart failure, but kidney failure, liver failure, and brain failure. In fact, if you look at the MRI of the brain they did as soon as they brought him out, most of the white matter in the brain had been destroyed by inflammation. Now, his neurosurgeon got a call that night from the governor of West Virginia saying, do not let this man die. So he says, oh my God, what am I going to do now? So he gave me a call that night and told me, say, oh my God, what am I going to do now? I said, what we'll do, let's basically start feeding him high levels of fish oil. We have to put out the fire. He said, great, how much? I said, about 15 grams a day. He said, well, he's going to bleed to death. I said, he's not going to bleed to death because we'd already published the data giving that levels to the kids with ADHD. So for the next 2 months, we immediately airmailed some of our fish oil down to him that night. We started feeding him through his feeding tube 15 grams a day of long-chain omega-3 fatty acids. And after 2 months of this tube feeding, Randy came out of his coma. We kept feeding him orally, and 2 months later, just another picture of the brain, again, very little white matter. And this is our protocol, a 2-to-1 ratio of EPA to DHA. Why? Because the brain was on fire. DHA is not going to put out the fire. The EPA does. But we're giving very high dosages. But during this time, we are measuring the ratio of arachidonic acid to EPA in the isolated plasma phospholipids to ensure the ratio never dropped below 1.5. And why the 1.5? That's the level you find in the Japanese. If it drops lower, you do have a risk of hemorrhage. So we basically kept a very tight control by measuring the blood on a weekly basis to make sure we were feeding him enough, but not giving him too much. So after we started feeding Randy for another 2 months, he then went home. 4 months after the disaster, he pulled out basically, for all intents and purposes, a dead man. He went home. His heart was normal. His kidney was normal. His liver was normal. And he gave a press conference worthy of any Italian politician. And so what did the best investigative reporters of America say about this? They said, it's a miracle. It was no miracle. It was simply good use of anti-inflammatory nutrition to put out the fire in the brain. And once you put out the fire and set the right formation, you can rebuild the brain so basically one can experience a better life. This is a picture of Randy and his wife and myself and his neurosurgeon, Julian Bales, about 9 months later, and you can see that Randy's wife is pregnant. They've since that time had 2 healthy children, so everything seems to be working pretty well. So it wasn't there was a miracle, it was simply aggressive use of high-dose fish oil using high-tech monitoring the blood to make sure we were giving the right amount, maintaining a level of inflammation, maintaining it in a therapeutic zone. Now, Randy's not the only person we've worked with this protocol. We've done now really a total of 7. Randy was the first. He was a coal miner. He recovered. We had a firefighter who was basically had brain trauma due to carbon monoxide poisoning. He recovered completely. A 12-year-old baseball player got hit in the chest. They used a pitcher and basically knocked out his heart. They gave him into a coma and cardiac arrest, and he too totally recovered. Another firefighter in Kentucky, carbon monoxide poisoning, into a coma, total recovery. Loggers, a woman with childbirth, stroke. This becomes, at some point to say, why aren't people using this all the time? What's the downside? Well, there is none. The upside is saying most of these people probably would have been dead. And this is the problem. It takes time to change medical thinking, because I say it can't be this simple. But the use of high-dose fish oil is incredibly complex because you're targeting the fatty acids to enter directly into the brain. We have no drug technology that can do that. But if you use the right fatty acids and maintain the adequate levels, you can do that. And once you put out the fire in the brain, you give the brain a chance to heal itself. And what's our biggest fear in the future? It's called dementia, really Alzheimer's. And this is a study published about a decade ago when they could look at people who were age-matched. They're all elderly, but they had either normal cognitive development or Alzheimer's or other dementias or cognitively impaired. And what you could see is that was a striking difference that those who had cognitive impairment, their levels of arachidonic acid EPA were about double to those who basically had normal brain function even though they were elderly. So if you're fearful of dementia, one of your best things you want to do is to keep the levels of arachidonic acid to EPA as low as possible, consistent with excellent health, just like in the ratio found in the Japanese population. Now, this is a interesting concussion study. This is a concussion study not caused by a carbon monoxide poisoning. This was a professional hockey player whose career was ended with his 4th concussion. And when he finally came out, so he basically had the concussion for 18 months. The best and brightest in the medical community of Boston said, these things take time. Well, after 18 months, he had seen no change. He had terrible headaches all the time. He had tremendous light sensitivity. He couldn't exercise. He was getting irritable. And best thing to say, these things take time. So eventually he came to our laboratory. We measured his ratio to arachidonic acid to EPA, and it was high, incredibly high. He said, here's your problem. Once we reduce that, we should start to give the brain a chance to rebuild. And again, we put him on a protocol, about 7.5 grams of omega-3 fatty acids, about half the level that we gave our coal miner. And within 2 months, his ratio had dropped down to 3. And all of a sudden, the brain started to rebuild itself. All of a sudden, he could begin to exercise again. His sensitivity to light was highly improved. The headaches were basically going away. Will it take time? Yes, it will take time because the brain rebuilds slowly, but it cannot rebuild unless you put the fire out first. And what about other neurological conditions that seem to be treated well with high-dose fish oil? Well, here's a study from Harvard about 12 years ago with bipolar depression, probably the most difficult of all depressions to treat. They were using 10 grams a day of these omega-3 fatty acids, and they had to stop the trial after 3 months because it became unethical to continue. The results of the patients getting the high-dose fish oil compared to the placebo were so dramatic, it was unethical to continue the trial. I was mentioning to David, we're just finishing up a study right now with children with bipolar depression, and when you look at their levels of arachidonic acid EP in the blood before they start supplementation, the levels were incredibly high, in the range of 200 to 300. Some of the EP we could not even find. We'd crank up the sensitivity of our machine and say it just wasn't there. And that's basically what you have to say. If it's not there in the blood, you know it's not there in the brain. If it's not in the brain, you have nothing to turn off the inflammation. And what about multiple sclerosis? Multiple sclerosis is simply rheumatoid arthritis inside the central nervous system. But unlike rheumatoid arthritis, the drugs we use to treat that cannot cross the blood-brain barrier. So what's the course of life for an MS patient? Continued downward spiral of quality of life. There's no drug that can reverse multiple sclerosis. But here's a study of a decade ago saying if I can basically start giving patients high levels of fish oil, that within 2 years, they're getting better. That's unheard of in multiple sclerosis research. But there's the data. It makes perfect sense. The fatty acids can pass the blood-brain barrier. And if you have enough EPA in the blood, you can put out the fire. And by putting out the fire, it gives the brain a chance to rebuild the new myelin tissue to reduce the symptoms and severity of the multiple sclerosis. Another neuroinflammatory disease we hear a lot about is called multiple sclerosis. Not multiple sclerosis, besides that, is called Parkinson's. And here's my most well-known Parkinson's patient, Pope John Paul II. Now, when we were working with the papal staff through our Italian partners, he was in terrible shape. So he said, let's give him lots of fish oil. And for the next 2 years, he dramatically improved. And it was, everyone said, it's a miracle. And they said, I feel so good, I want to go around the world and preach the gospel. I said, Pope, this is probably not a real good idea. You're 84 years old. You still have, Parkinson's, and this is a good time to rest. He says, no, I really want to preach the word. And not far be it for me to tell the Pope no. So he went out, did a couple of worldwide tours, and basically it was really just too much for him, the stress, and he started to decrease his basically ability and died probably about 2 months later. But during that time when he was basically staying in Rome and basically getting the high-dose fish oil, his improvement was remarkable. Now, these are human studies, and the thing about human studies, we really can't go in there and basically ask what's happening. So that's why you have to use animal studies. I hate to do animal studies because I think there's a certain type of karmic payback for killing animals. But if you want to ask questions about brain chemistry, you have to do it from time to time. So here's one study we published. This was published this year in the Journal of Neural Surgery. We took rats and basically gave them concussion injuries, just like professional football players. We would affix actually a metal helmet to their skull and would drop a weight on them so that basically the metal helmet would basically dissipate the injury uniformly through the brain. And this is a validated way to get universal injured axons. Will kill the animal, but it will definitely cause brain damage. And what we did to these animals is then basically split them into 3 groups. We had a placebo group that got a placebo oil and increasing amounts of omega-3 fatty acids. And you can see after 1 month after the brain injury that those getting the placebo levels, their levels of omega-3 fatty acids in the blood actually were decreasing, where there's a dose response curve in terms of the omega-3 fatty acids in those getting the supplementation. And if we look at the ratio of arachidonic acid the EPA in the blood, even though the damage was done in the brain, there was a dramatic increase in the ratio of arachidonic acid to EPA in the blood, indicating even though the damage was located in the brain, it was now basically increasing systemic inflammation throughout the body. Whereas the animals, which were getting the omega-3 fatty acids after the same entry, there was virtually no increase in the ratio of arachidonic acid to EPA. Now, what happens when you get a snapped neuron during these concussions? The neurons actually snap. And at the end of the snapped neurons, you start to see the accumulation of what are called amyloid precursor proteins. These are the same type of proteins that are the hallmarks of the beginning of Alzheimer's. And they tend to accumulate in the end of the axon that's been snapped. So you can look at these and you can find them. These are the animals that basically got the injury but no omega-3 fatty acids, and they're all over the brain. But those who basically got the omega-3 fatty acids, you can barely find them. Same injury, no preloading of omega-3 fatty acids, but basically giving the omega-3 fatty acids as you would after the injury, just exactly as we've done to the coal miner in West Virginia, and virtually no damage. Now we could quantify these. We could look at the number of these amyloid precursor positive axons, and those who got no supplement, very high levels. Those who simply got the helmet affixed to them but no concussion injury, that was the control. And those who got the same injury but the omega-3 fatty acids, again, almost identical to the control, as if there was no damage. There was obviously inflammation caused by the concussion, but the omega-3 fatty acids given directly afterwards had basically put out the fire in the brain to allow it to repair itself and not get the buildup of the amyloid precursor proteins. So the last thing I want to talk about is when you come to neuroinflammation, test, don't guess. You know, we spend so much time guessing how much omega-3 fatty acid we should give somebody. Would be for heart disease, diabetes, obesity, neurological problems, or cancer. But that's what science tells us. Test, test, test. And what we want to be testing for? The ratio of arachidonic acid to EPA. So this is some work we do in our laboratory. And in our laboratory, we have what is called a CLIA-approved laboratory. This is like an FDA approval for a drug plant. You have to go through considerable regulatory approval before you get CLIA approval. So when we look at basically a seemingly normal group of individuals, about 132, what you see is their ratio of arachidonic acid to EPA breaks into two distinct groups. This group are those taking fish oil, and this group are those who are not. And so we use these ballpark markers of the ratio, saying these are ones who have a low level of cellular inflammation, and these have a high level. So let's look at these groups in a little more detail. The average in this group was about 2.3. Here, in this second group, about 7. This group about 12. But the average, and these were normal people, the average in this group was nearly 70. Again, very, very high levels of cellular, but they were seemingly healthy. They were not well, but they did not have enough damage due to the inflammation yet to basically call it chronic disease. Now let's compare these two Japanese. This is our American group of Americans who are taking fish oil. Average ratio about 2.6. Good, especially for Americans. But the average Japanese is about 1.5. And a recent study, a very major study called the JELLA study, with some 18,000 cardiovascular Japanese patients, that when you took the Japanese population and add extra fish oil, the ratio drops even further. Now with that drop in that ratio came an additional 20% drop in cardiovascular events. What's interesting about this JELLA study that both groups were all getting statins. So the placebo was the statin. The active was the fish oil. And adding extra fish oil to a group that already had a low ratio of arachidonic acid EPA dramatically improved their outcome. And we can look at a dose-response effect. This is a study published last year in the American Journal of Clinical Nutrition, taking women at high risk of breast cancer and then giving them various dose amounts of EPA and DHA. Those who got nothing, their ratio is about 12. Even though they're high risk, they were still pretty good shape, not quite bad, but pretty good. Those who got 800 milligrams a day, there was a drop age down to about 5. Those who got 2.5 grams a day dropped further to about 2.2. And even here at 7.6 grams a day, they're about 1, just about like the levels of the Japanese. So that you can see there is a dose-response curve that tends to be asymptotic, at least in the blood. But this study was interesting because they were looking at women who had high risk of breast cancer, and so they also looked at the adipose tissue in the breast. And even though the blood levels seemed to hit a plateau after 30 days, that the levels of the fatty acids in the breast kept increasing for 6 months. So even though that the levels of the arachidonic acid, the EPA in the blood might be stabilizing, getting them into the target tissue, whether it be the breast for breast cancer potential or into the brain, will be a long-term process. And this is, again, we talked about that subject, the hockey player, the professional hockey player, that this was the starting ratio. This is the ratio after 60 days, and continuing the same amount, it remained stable. So even though it was stable, just like the breast cancer patients, it's going to take time to get those fatty acids into the brain to put out the fire completely so we can start rebuilding the brain again. And we can look at the sensitivity of this test. This is basically looking at, because this is a whole blood test. We've done this, when we do research, we usually look at the isolated plasma phospholipids, but that's a harder, it's a more elegant test, but it's more difficult and requires a venous puncture. People hate to give blood. So we developed this test as really looking at giving a test using a finger stick, just like you would for a glucometer. And you can see, as you put different amounts of blood there, that the level of arachidonic acid in this one person here was incredibly constant, as you would expect. If we look at stability, and because we basically do this at room temperature, the stability, we put this on filter paper, up to 7 days, the ratio really doesn't change. This is an individual who had a very low ratio. He was taking fish oil. Here's an individual who had an intermediate ratio, was taking intermediate amounts, again, very, very stable. And here's somebody who had a very high ratio, and again, very, very stable. So this is a very great test because you can do it in a doctor's office, put it on a filter paper, put it in an overnight envelope. It comes to our laboratory, and we know the levels, the fatty acids will be stable, and we can get an answer back in about 7 days of what the levels of cellular inflammation is in that particular patient. It's a great screen, it's easy, it's convenient, and inexpensive. So this gives rise to a really exciting concept in my mind of predictive medicine. Not preventative medicine, predictive. That the ratio of arachidonic acid to EPA will basically predict how fast you will develop some type of chronic disease. I can't tell you exactly which one. For some it might be heart disease, for others cancer, for others still neurological disorders. But you're already moving down a slippery slope. And it's quite clear this ratio of arachidonic acid EPA rises years before downstream markers like CRP rise. So it gives you an insight of how basically not to treat a chronic disease, but how to push a patient back toward a state of wellness. And my definition of a state of wellness, your ability to control cellular inflammation. And that's measured by the ratio of arachidonic acid EPA. This can only be altered by the diet. There is no drug known in medical science that can change it, but an anti-inflammatory diet, especially an anti-inflammatory diet rich and supplemented with rich in EPA, can be a very powerful tool to move a patient back toward a state of wellness. So I go back to my earlier slide where I said oftentimes we make medicine more complicated than it really is. In many ways, I view medicine as like an iceberg. We see the tips of an iceberg, but most of the iceberg lies underneath the surface. Today, we see the cancer, we see the autoimmune diseases, we see the neurological diseases, we see the heart disease, we see the aging process. We think each one is separate. But in reality, they're all interconnected, and much of the problem lies below the surface. Here, the cellular inflammation. This is the key factor. We can attack this by the diet. It doesn't say that food will replace drugs, but it does say that food, if you treat it like a drug, be taken at the right dosage and at the right time, can make drugs work better, meaning they work at lower concentrations, which means lower side effects. But the cellular inflammation, which has been virtually unknown because it's almost undetectable, we can now measure it. Measure it that's easy, inexpensive as a screen, and know how to attack it. And the more you reduce cellular inflammation, the size of these peaks gets smaller and smaller and smaller, which means you need to use less and less drugs to stabilize and manage the patient for a lifetime. So in summary, cellular inflammation is the underlying cause of virtually all chronic disease, but in particular, neurological disease. It can be very rapidly reduced by high-dose fish oil. If you use high-dose fish oil, test. Don't guess how much fish oil you need. The test is available. It can be done. It gives you precision as a physician to say how much fish oil. I need to give enough, but I don't want to give too much. But you can't rebuild the brain until you put out the fire. Once you put out the fire, now you have to follow an anti-inflammatory diet to rebuild the brain and rebuild it without building up the inflammation that caused the problem in the first place. So that's my review of basically inflammation and really focused on neurological diseases, and I'll be happy to answer any questions that you may have. David?
I'm here.
Did I hit something wrong?
I'm here, Doc. Yes, I'm.
Okay.
I'm here, Doc. Yes, I'm. Hang on. Let me mute you. Okay. Okay. Wow. What an amazing presentation, folks. This is. Told you at the beginning this was going to be a masterful presentation, and this is. Thank you so much, Doc. All right, folks, if you're new here, just remember you can go in and type your questions in the panel to the right of your screen. I tell you what, if this doesn't explain inflammation, if this doesn't explain how the brain functions and what you need to do to protect your brain, I don't know what does. So thank you again, Doc. And again, I had quoted this quote at the beginning of the presentation. I think it's only fitting that we bring it up at the end, because that's exactly what Dr. Sears has been talking about. The fact that you can use nutrition, food, as a tool, as a weapon to combat chronic disease has really come to light in this presentation. It's a concept that most doctors are not aware of, and I think that is to be regretted. But as he continues to do what he does, and as more and more people around the world do what they do, more and more people it will become more and more into the light. My only question, Doc, is after successfully treating the Holy Father, I don't know why you were not made a saint. We should be calling you Saint Sears now, or Saint Barry. Okay, you're muted, so if you're going to respond to that, hang on just a minute. Okay, I'm going to take out the questions. And each time I ask the question, Doc, I'm going to mute you. So just pause briefly after I've asked the question, and then you can take it. So for some reason the echo is really bad. All right. First question: which combination of fish oils are you suggesting? I was told there were different ones for the two genders. And should fish oils be taken all year for all age groups as prevention? So I'm going to say it again. Which combination of fish oils are you suggesting? I was told that there were different ones for the two genders. And the second question is, should fish oils be taken all year for all age groups? And folks, just remember that Dr. Sears, his website is drsears.com or zoneliving.com. Over to you, Doc.
Unmuted.
Well, this is again that we talk about fish oils, but we're really talking about the omega-3 fatty acids. Yes, there are many fish in the world. There's salmon, there's tuna, there's herring, and each one have different ratios of these fatty acids. But again, the fish oils by themselves are unsuitable for human consumption. This is the fact of our life, that fish oils tend to be, there's no fish in the world that is not contaminated with contaminants, pollutants we put into the environment in the last 2 generations. Would be mercury, PCBs, dioxins, flame retardants. They're all there and they accumulate in the fish oil. So the real challenge that we had a decade ago was to basically remove the toxins and to increase the concentration of the omega-3 fatty acids. So today that virtually all fish oils come from either sardines or anchovies off the coast of Peru. And they are broken down into the fatty acids and then basically purified to make agents which are either rich in DHA or EPA. As I said, that the key factor here, if we want to reduce neural inflammation, we have to have high levels of EPA. So in all of our studies, we always use a 2-to-1 ratio of EPA to DHA. Now people say, well, but do males and females need different amounts? Of course not. They need exactly the same amount. But it's not how much they need. That's why you test for the blood. You test for the blood continually to see basically are you giving them enough or possibly giving them too much. Now, do you need for all year? Of course you do. Why? Because the lifetime of the EPA in the blood is about 2 weeks. So if I stop taking the EPA, within a month, the levels will drop down dramatically, which means I'm a sitting duck for increased inflammation. This is something you have to take every day the rest of your life if you want to control cellular inflammation. If you feel lucky, take it when you want to. Frankly, I don't feel that lucky, so I take mine every day, and I test my blood at least once a month. I happen to have a laboratory right next to my office, so I can do that. But testing it at least once a year, and ideally twice a year, is a real good idea.
Great. Doc, obviously there are quite a few questions about where to get the good quality fish oils, and I know, Doc, you're not much of a self-promoter or marketer, so I'm going to say it for you. Folks, Dr. Sears, obviously from your presentation, produces some of, if not the very best kind of fish oil, and you can go to his website again, drsears.com, zoneliving.com. And Dr. Sears, if you have anything else to say about that, please go ahead. But I'm going to ask the next question so you can cover that as well. Okay, also to test for your AA-EPA ratio, again, that's at Dr. Sears' lab. And he's not paying me to say this, by the way. It's just that's just what we do, provide you with the best kind of information. All right. Can fish oils be broken down and injected directly into the damaged brain?
Unmuted.
They possibly could be. However, it's pretty dangerous because the fatty acids by themselves, can act as surfactants and basically tear up membranes. But if you basically give the fish oil orally, 100% will be absorbed. So why would you want to inject it? Say, do I want a joint specific? You possibly could, but it really doesn't make sense. So I think that there's only one case where we had at Harvard Medical School where they gave an infusion of emulsified fish oils. But to emulsify them, you cause a lot of oxidative damage. So that's why there's no commercial product, no drug product on the market today that's emulsified fish oil that can be injected. Going back to what you said, how can one tell if it's a good fish oil? Well, we come to believe that all fish oils are the same, which nothing could be further from the truth. The hallmark of a fish oil is really the levels of purity, as can be measured by the levels of PCBs. PCBs are nasty little things. They're known carcinogens, they're known neurotoxins. So one way you can look at the purity of the fish oil is the levels of PCBs. And we spent a long time working on new manufacturing technologies, and that's why it's ironic. There is one prescription drug in the market. It's called Lavazza. And it has low levels of PCBs. The fish oil that we make has 5 times lower the levels of PCB. So it's 5 times more purified than Lavazza at a fraction of the price. Now when you go to a health food store or go to the supermarket, what you're buying is invariably the sewer of the sea. Because these people are looking to basically say, I'm trying to get as much fish oil in there at the lowest price, and saying, buyer beware. So if you buy it at a health food store and you want to have a health food clerk behind the counter give you all the advice of which to buy and which we can get the 2-for-1 special, God bless you. But if you want to get good fish oil, it has to be pure, and the hallmark of purity are the levels of PCBs. And we like to think that we have, I won't say we think, we know, we have by far and away the lowest levels of PCBs of any fish oil available today with or without a prescription.
Fantastic, fantastic. And Doc, I think you still need to explain the toothpick test too. I think I need to have you do that on a separate video, really, so people can see that in the future. But when after this question, please explain fish oil as well. We have a couple of some of my presenters who have been on this, who came on to listen to you, and they are saying, like Dr. Kulish, who is a brilliant naturopath and European health practitioner from Poland, says this is an excellent presentation, and Marianne will be coming on to talk about how auditory processing can affect your brain, and she says this is wonderful information, and I could not agree with her more. Okay. Someone says, if we need a doctor's prescription for a blood test, what is the name of the test we want? Is it just the AAEPA test that we should ask for?
Well, you can ask for it, but the doctor won't understand the thing about it, because it's not a test done by major laboratories. It's done by a lot of research applications, but it's not a standard clinical test. There are very few laboratories in the country who do this test. We're one of the few laboratories that do. So it's just really trying to find a laboratory that can do it and do it on a consistent basis. Because again, the key for any diagnostic test is not getting a number, but the consistency of that number. That's why I showed all the data that we've used in our validation for our CLIA approval to show that yes, we can get a number, and it's a consistent number that can be repeated over and over again. So finding laboratories that do this testing are difficult at best, because it's not a standard test. Hopefully it will be in the future, but right now it's a very specialized test. We're one of the few laboratories that actually do that.
Okay. What do you think about heavy metals on brain function and brain inflammation?
Unmuted.
Well, heavy metals are nasty little things. Things like mercury are not very good for brain function. Lewis Carroll told us that in the Alice in Wonderland, talking about the Mad Hatter. So that's why one of the things in terms of fish oils, you want fish oils which are very pure, especially in terms of things like organic mercury. So anytime you have heavy metals in the body, the most likely target are these long-chain polyunsaturated fatty acids. And once they basically interact with them, they become a constant generator of inflammatory damage. So you try to keep these heavy metals in your diet to a minimum. Easier said than done, but it can be done. But once they get in the brain, they're like the Roach Motel. Once they check in, they don't check out.
Do fish oils detox the brain from environmental toxins?
Unmuted.
Go ahead, Doc.
No, I didn't hear the question.
I apologize. Do fish oils help detox the brain from environmental toxins?
Unmuted.
Well, again, the word detox is probably the most abused word in the English language outside of moderation. So when we say detox, what does that really mean? Are there toxins that get in the brain? Of course they are. And usually they're fat-soluble toxins, things like PCBs. There's two organs in your body that are very rich in fats. One's called the adipose tissue, and the other is called the brain. Now, the adipose tissue sucks up a lot of the lipid-soluble toxins, and it kind of buries them like toxic waste. And what happens when you begin to lose weight? Well, you start to unbury the toxic waste, and now it goes in the bloodstream and goes to the next organ that has the highest concentration of fat, which turns out to be the brain. So detoxifying the brain, I think when we deal with brain chemistry, we're really talking about reducing the inflammation in the brain. It's not that there's a toxin causing problems, it's the inflammation in the brain coming from fatty acids, which are natural constituents in the brain, but their balance is now out of whack. So I think when we talk about brain chemistry or brain detoxification, it makes very little sense. If we talk about an imbalance of omega-6 to omega-3 fatty acids, and more likely an imbalance of arachidonic acid to EP in the brain, that's my definition of, quote, toxicity. That can be adjusted by the diet. It's slow, it's hard because, as I said earlier, the arachidonic acid has a very long half-life in there. It takes time to reduce its levels, and at the same time, to maintain adequate levels of EPA, you have to have high levels in the bloodstream to counterbalance that as you take down the arachidonic acid, not by a drug, but by a diet.
Okay, lots of questions on the testing. Can we do it without going through a physician? Where do we get it from? How do we test it? So, Doc, can you just give us a step-by-step way of getting the AAEPA tested, please?
Unmuted.
Well, there's a lot of laws we operate here in America, and one of which our lawyers tell us all the time, is that basically that any blood test, and our laboratories in Massachusetts, so as a CLIA-approved laboratory, we cannot accept any biological sample, whether it be a blood test or a finger prick test or even a saliva test, unless it's basically submitted by a physician. That's just the rules of the land. It doesn't say that people don't get around that, but that's how we operate. So it really has to be done by a doctor, but doctors are the world's worst phlebotomists. But even a doctor can do a finger prick, and that's the way that you probably have to take the test to the doctor. You can get the test from us, but it has to be submitted to us from a doctor. So it's taking the test to the doctor, having the doctor or really Nurse Betty do the finger prick, put it in the envelope, send to us Federal Express, and then we basically get the test results back to both you and the physician.
Okay, excellent. There are questions about disease. Obviously, folks, we cannot directly address diseases here, but just know that chronic diseases as a result of inflammation, and you can test and prevent and predict, as Dr. Sears put it. And of course, if you have any more questions, I think you can contact go through his website. Okay, could you please put back on the screen the slide about blood test for predicting future dementias? I'll hand the screen back to you for that. Do omega-3s affect statins, or is that stents or statins? JR, please clarify that. Is it stents or statins? Please let me know. Where can we get the test kit? Where can we get the test kit? Okay, Doc, I'm handing the screen over back to you so you can get it. And then the question is, where can we get the test kit? And then, of course, the usual question, krill oils. What's your stand on that?
Unmuted.
Okay, relatively, I put on. I hope you can see the slide here that looked at this data coming from the cognition. Oops, obviously put my slide back on there. I think I can see it there. I'll basically go down here. And this is the slide that I talked about, demonstrating that the higher the level of arachidonic acid EP, the more likely you are to be cognitively impaired.
We can't see it yet because you haven't accepted.
Again,
we can't see it yet because you haven't accepted.
Oh, okay. thought I did there. Okay. That's not on my screen here. So
Okay, I'll take it back, and then you can try it again. Okay, and back to you.
Unmuted.
okay, I don't think I did this correctly here. It says showing screen. I don't know if I'm seeing it or not, but you know, the data is pretty clear that the higher the levels of arachidonic acid EPA, the more likely you are to be cognitively impaired.
Unmuted.
David, did the slide show up?
No, sir, it is not up yet.
Okay, then we'll basically just kind of wing it. So what's the question again?
Krill oil. What do you think about krill oil? Okay.
Unmuted. Unmuted.
David missed the question.
Got it. All right. Sorry, folks. We're having to juggle a few things here. Okay. The question is, what about krill oil? What is your stand about krill oil? And then he goes on to say the reasoning for krill oil is that it is lower on the food chain and hence pollution could be less than the regular fish oil. And Doc, if you can talk about the toothpick test again, that'll be great.
Right. Well, let me talk about krill oil first. We do the most sophisticated testing of PCBs of any company in the world, and we use the company that's used by the U.S. government for all the Superfund testing. So when we basically test our fish oils, and these are very extensive tests, they take about 2 days to do. You can basically actually measure the levels of PCBs. Now, we've looked at a lot of oils. We've looked at oils from China, and they're just chock full of things. I have no idea what they are, but they shouldn't be there. And when I look at krill oil, it's even worse. Something in the chromatograms that we use to look for PCBs, there is a mess of stuff early in the chromatogram that is not there in highly purified fish oils. I don't know what it is, but I know one thing, it shouldn't be there. So we want to believe that krill oil is lower on the food chain, but in reality, it is, highly contaminated oil, in my opinion. And so again, this is a great hype. I think people are being led astray about saying it's pure, but no, when you look at it, it's just the opposite conclusion. It looks like it's a real mess. So I'm not a big advocate of krill oil. Now, relative to one simple test, unless you have $500,000 of testing equipment in your kitchen, which most people don't, is a simpler test, looking at what I call the toothpick test, where you can take 4 or 5 capsules, break them open, and put them in a shot glass, and put the shot glass in the freezer, and come back 5 hours later with a toothpick. If you can't put the toothpick through the fish oil, then it's probably the sewer or the sea. If you can, you have an outside chance it might be okay. So it's, again, when it comes to fish oils, it is truly buyer beware out there. Even the company who basically makes the pharmaceutical fish oil, it's a big company, it's called GlaxoSmithKline, they consistently lie to the consumer. They say, we have no PCBs in our oil. It's so pristine. And I say, hey, liar, liar, pants on fire. Of course you got PCBs. We can measure them. So again, that you find, whether it be Billy Bob selling his fish oil at the corner, going to GNC, or having SmithKline Glaxo, what you find is the consumer and the physician is getting consistently not bad information, basically in some ways simply lies. So it's a difficult process out there to try to get across to people that think, try to find good quality oil and don't believe the hype that usually comes with the oil.
Okay, a couple of really good questions. And Doc, let me know whenever you have to go, because there's a couple more questions coming in. Obviously, this is a topic that everybody is very, very interested in. I'm going to ask 2 questions. Can a brain that has been injured in past years, and in this case it was PTSD and severe anxiety, so I'm assuming this is like 4 or 5 years and above, can the brain still recover with this protocol? That's one. The other question, Dr. Coolidge is asking, did you work with autism and Gulf War syndrome patients? And I guess, okay, there's a third one. If I need to ask them, I can ask them again. Can the body convert DHA taken orally to EPA? And of course, DHA is what makes up the brain cells, right? And EPA is primarily the anti-inflammatory portion of the omega-3. So there are three questions. Past damage years ago, can the body still recover with this protocol? The second one, have you worked with autism and Gulf War syndrome patients? And third one, can DHA be converted to EPA by the brain?
Unmuted.
Well, those are three very good questions. The first question is, the answer is yes. And so the question, where do you find brain damaged people? We find them very easily. They're called retired NFL football players. And so we do a lot of work with retired NFL football players because they have significant brain damage. Make no mistake about it. And the ones we've worked with, especially those who had high levels of arachidonic acid EPA, we can basically begin to reverse that brain damage. It takes time. But in about 3 to 6 months, you see significant improvements. So here's brain damage that's been existing there and accumulating over a 20, 30-year period, and it can be done. We have not had any direct evidence with autism, though the literature strongly suggests that autistic children have low levels of omega-3 fatty acids, just like children with ADHD, and some preliminary testing seems to indicate at low dose of EPA, some benefits are there. But again, you had to give a therapeutic dose, and you can only do that by having a blood test. We have a grant into the government to treat their soldiers, but we have not heard back on that grant. Because again, the prevailing aspect in the world of neurology, that EPA is not important, only DHA is important. And this leads to the third question, can DHA be converted to EPA? Yes, it can be, through retroconversion, but it's a slow process. That only about 10% of the DHA can be retroconverted into EPA. And that's through the EPA that all the anti-inflammatory action takes place. That's why when we work with fish oils, especially in brain damaged patients, we always use oils which are much richer in EPA than DHA. They're both important, but if we're trying to put out the fire, the EPA is far more important than the DHA is.
Excellent. Okay, well, I have a question of my own. If someone suffers a stroke, and obviously they're waiting for the doctor to come pick them up, what would you suggest to their caregiver or themselves to as a means of recovering, and what's the best thing they can do for themselves, in other words, and even after treatment by the doctor, what's the best thing stroke patients who have obviously have severe would have severe inflammation from damage? What would you suggest to help them recover?
Unmuted.
Most important thing is take adequate levels of fish oil. And in stroke patients, what we've seen, we usually basically go in the range about, between 5 and 7 grams. Again, using the blood test to make sure the levels never drop below 1.5. And basically then what you've done, you're now supplying the primary mediators, because when you deal with a stroke, what you're talking about is the equivalent of a heart attack in the cerebral arteries that feed the brain. And brain cells are dying, and they're causing inflammation. So when you talk about stroke, you're talking about inflammation, just as heart disease is a disease of inflammation. So it's good for the heart, as Hippocrates said, 2,500 years ago, is also good for the brain. So if I had a stroke, the first thing I'd be doing, I'd be getting as much fish oil into my system as I possibly could.
Okay, questions on Alzheimer's disease. Obviously, that is, of course, due to damaged brain cells. But Doc, if you want to talk about that, you're free to, based on your research. Folks, a lot of questions coming in about testing. So again, Dr. Sears' website is drsears.com and zoneliving.com. I believe, Dr. Sears, there should be a phone number there that they can call in to have their questions answered further, right?
Definitely.
Unmuted.
The answer is definitely yes. And all the information about the blood test should be on the website. probably no later than the middle of August. That time we should get all of the legal approvals, and we live in a litigious society, so we have to pass everything by our legal people. But everything should be on the website by no later than the middle of August. But if they have any questions, by all means, just give us a call. We have our people here that have been with me for 20 years. Our number is 1-800-404-8171, and just ask for our director of technical support. That's Dave Schreck, and he can work with the individual.
Excellent, excellent, great stuff. All right, a couple more questions, and we'll wrap it up for tonight. Okay, I have a stent. Do you mean a stent, JR? Doc, have you heard of the word? This is stent. Okay, you mean stent. Okay, that's what I was confused about. Okay, let me go back to your question, because I know you've been waiting to have that question answered, and then after that we'll just wrap it up for the night. Obviously, there are some questions about flaxseed oil. I know Dr. Sears compares that. Those have fewer toxins because they are plants, but Doc, if you can address that briefly as well, that would be great. I'm trying to find out where JR's thing is. Hang on. Okay, do omega-3s affect stents? Help. Okay, so the thing about flaxseed oil, and then do omega-3s affect stents? I don't know what you mean by that, but Doc, you can answer it the best you know how.
Unmuted.
Let's talk about the flaxseed oil. It is true flaxseed oil doesn't have the toxins. Unfortunately, the flaxseed oil doesn't have the long-chain omega-3 fatty acids either. And even though it contains short-chain omega-3 fatty acids, their conversion into the long-chain ones, they have all the anti-inflammatory benefits, is very slow and very inefficient, which means you need probably 50 to 100 times the volume of flaxseed oil to have the same anti-inflammatory benefits of an equal volume of fish oil. It's just not a very efficient way of reducing inflammation. Relative to stents, once you put a stent into the vascular bed, you're causing inflammation. In fact, when I worked at Boston University Medical School 30 years ago, that's how we used to basically build atherosclerotic lesions. You would basically give a stent to a monkey, and that would cause inflammation, and you can see atherosclerotic lesions build very rapidly. So if you're giving a stent, which is one of the most common surgeries in America today, you should be giving the patient omega-3 fatty acids at the same time to keep the inflammation under control. If you don't, what's going to happen is called restenosis. The lesion will reform very, very quickly and close the artery again. So if you're giving a stent and or putting a stent in and not giving fish oil at the same time, you're simply practicing bad medicine, in my opinion.
That's almost like giving large amounts of statins without supplementing with omega-3s and CoQ10. I think that's a bad idea, too. Well, this has been great. This has been extremely informative again, Dr. Sears. Thank you, thank you, thank you. This is we're so honored that you could take the time to do this. We really, really appreciate this, and hope we can work with you more and more in the future. Any final words before we wrap up?
Unmuted.
No, the only final word I'd say that we're standing on really a cusp of really the future of medicine. And I think that basically we have done all we can with drugs over the last 80 years. That's why you're seeing the pipelines in the drug industry drying up, because all the easy targets are gone. In fact, the things we thought we conquered are coming back to basically haunt us. We thought we conquered infectious disease until AIDS reappeared, and now we have microbial-resistant infectious disease. So we have to really go back to first principles of how we used to fight these microbes and basically maintain health before the advent of drugs, which was only 80 years ago. And the answer was basically a diet, treating food like a drug. And Hippocrates put this best 2,500 years ago when he said, let food be your medicine, let medicine be your food. With our new breakthroughs in molecular biology, we now understand the wisdom of his statement of the more we can understand how the food we eat can either turn on or turn off inflammation, the longer and better we're going to live. The sooner we learn how that the wisdom of that adage and how to practice it is how we turn around and hit the healthcare mess we have in America today.
Well said. Well said. It really is a mess. Well, hopefully we'll turn things around. And again, thank you. And lots of people saying thank you, thank you, thank you, thank you for coming in. Thank yous coming in. All right. Someone is asking for the website again. Website is drsears.com. His other website is zoneliving.com. drsears.com and zoneliving.com. And quite frankly, I think we should just make this presentation available to everybody on our email list. So we'll just send this out and let everybody take advantage of this, because I think this is just a fantastic, fantastic presentation. Okay, Dr. Sears, thank you. God bless you, everyone. Have a good evening. Bye.